Hello, so in this video what I'm going to do is show you how I mix putty and why I mix it the way I do. Now, to start with, I use the Virtual. It's a fast set putty. It's quite expensive, but it's really good, and the reason it's good is because of its consistency. So some putties, they're sort of how do I explain it? They're kind of quite spongy and they've got like a little bit of give to them. Virtual is really nice. It's got just the right consistency to it. When you roll it out, it's not too floppy, but it's not too stiff either. And when we're taking an impression, it gives really good detail reproduction as well. But it doesn't. It's nice and soft, so it doesn't depress the tissues too much. So I find it's quite good for the border moulding. I haven't got a patient here at the moment. I haven't got a special tray. Now what I normally use is a special tray that's made short, not extended to the full extensions, because as I say, I do border moulding, so you don't want to overextend those trays, which is then going to push and put more pressure on the cheeks and things like that. So keep it nice and short. For this demonstration, I'm just using a normal stock tray just to show you. Obviously this one's got holes in. When I have the special trays made, I have them made without holes, nice and short, and I don't use silicone glue. Even though I'm doing a silicone impression, I don't use silicone glue, and the reason for that is silicone glue is really good, too good. Putty will stick to it and it won't come off. So with a fall like this, it's not a problem. This is never going to get stuck in the mouth. But if you're taking a silicone impression where the patient has dentition and there's a chance that it could get locked in around those teeth, you really don't want a strong glue on there, which is going to prevent you from taking that impression out. The way that I do it in those sort of situations, if it locks in around the teeth, as long as this glue isn't too strong, you can literally peel it out, peel the tray out, that is, the silicone's still in the mouth, and then you just tease out the silicone of the mouth in that way. If you have to destroy the impression to get that out, which has happened to me in the past, it doesn't anymore because I've got some tips and tricks for that as well, which I'll do in another video. But usually you can just tease out that impression material. It's a lot more flexible when the tray is not in situ. If the silicone's stuck to that tray and you can't remove the tray independent of the silicone, then you're stuck. Basically, it's very difficult to then, will take you a long time to get it out. Whereas this method, literally just take the tray out and then tease out the impression material, and as long as that impression material is fully set and it's silicone and it's addition cured silicone, then it won't deform or change shape. If it does, check it. If it has deformed, just start again, and we do that by blocking out any gaps between the teeth that has caused it to lock in. With this, I'm not showing you full impression, I'm just showing you how I do the putty part of it. Now I always have 3 bits made up in each tray, so this is just prepared ready for me. So the nurse does this bit. When we put the lid back on, we've got those 3 bits that are all ready to go, and it's small, medium and large. These are not being done particularly well because the medium and large are pretty much the same size. Generally it'd be something like that. I can't even tell the difference between these two. Right, so take that down. The reason I have the 3 sizes like this, if I'm doing a single tooth impression, let's just say I'm adding a tooth to a denture, I'll just use that little bit, mix that in, and that's just enough for that. And then the large one is this one, which I normally use for most case scenarios of doing an impression. But the medium one and the small one mixed together should be about the same size as the large one. So if you've got a large one, you need a little bit more, you can just add the small one to it and it's nice and quick. So as I say, we'd spray this with an alginate glue. I use the Henry Shine one. I like the Henry Shine one because it doesn't stick too much, but it dries quickly as well. So some of them are just really watery and the glue doesn't dry properly, and so then the alginate doesnn't stick and it peel off and distort when you're taking the impression. And with the silicone, so if you do full force, you'll end up with a big puddle, and that will just take way too long to dry. So what you want to do is control the nozzle when you're spraying and just do it lightly like this, so you get a sort of like splatter effect, and you do that over the tray. So you're just getting a splatter in and build it up. Okay, now you want to do this before you start taking the impression, because you need to give it time to dry. If you do it like this, you'll probably be waiting 10-15 minutes for the thick stuff to dry, but if you're just doing a little thin coat like that, within about 2 minutes that'll start going tacky and you'll be able to use it. I'll take the large of the putties. Now I won't be doing this, normally it'll be my nurse which will mix it, but my method of mixing is, the time of recording this is winter, it's not really a problem, you've got plenty of working time, but this does set quite quickly. In the summer when it's warm, this can go off like a rocket. I mix it a certain way to give us the maximum amount of time to work with it before it sets off. And the way that I do that is, when you put the two together, you squash them and you turn in, you just fold in the silicone almost like you're trying to turn it inside out, and at the same time you're turning it round, and as you get used to it you'll end up getting quite quick. And it's the same principle with kneading bread, where you're folding it in on itself and you just keep folding this, and what this is doing is it's going to create a nice even mixture, and you keep mixing until there's no streaks in it. Now what I see people doing, nurses, when they first come in and start mixing, they're squashing it like this, and what you're doing is you're not really mixing it. It takes such a long time to mix it if you're squashing it so much like that. Okay, and they're doing it because they're rushing, but actually if you just slow it down and you'll just fold it like that, it will mix so much quicker. And the other big mistake that I see nurses make is, they will roll it around in their hands like this. When it's warm and your hands are warm and it's the middle of the summer and this has been sat on the side and it's warmed up, as soon as you start doing this, it's activating it, the heat, and it's going to go off a lot quicker. So you want to avoid putting it in the palms of your hands, and you're mixing it just with the tips of your finger, and by mixing it like this, it's even started to set because of doing that. You're just keeping it on the tips of your finger. You're not introducing air in. Again, if you're doing like this, you can get air trapped in there, and then that's going to, see that bubble there? That's because of the way I just squashed it, and those air bubbles are going to have an effect on the setting of the denture and cause distortions, because the air can expand at a different rate than the material. Anyway, this is going off now because I've been playing with it a lot. Then what I'll do, I'll just tease it around like that, get it ready, and then put it in the patient's mouth, push it up, leaving this out so we've just got a border on there. This is almost set now, so obviously I would have done that a lot quicker if I had a patient in the chair. Now this is not a functional impression, I want to make that clear. What this is doing is pushing out all the soft tissues out of the way. It's also depressing the frenums. Mucostatic tissue can be a bit compressed with it as well, so you need to be careful that this isn't set too much when you're putting it in the patient's mouth, that it's still nice and soft, which is the importance of mixing it as fast as possible without agitating it too much so that it sets really quick. You want to get it in the mouth while it's still nice and malleable. You put it in and you can massage the cheeks and things like that to make sure that it's picking up all that detail and there's not too much pressure on it. And you're not pushing it up really hard either. You're trying to just, you push it up enough so that you can feel the material compress. When that's done, I put a wash in it, retake the impression, and then you'll get a really nice silicone impression with lots of detail. The main impression material that I use, this is Henry Schein as well, it's a VPS Hydro and it's a light body fast set. However, I use this Imprep as well, which is a wash, and it's a light body rapid. This is rapid, this does set a lot quicker than the fast set. But what's really nice about this is it does flow under pressure. So once you put it in, it will flow in and pick up an incredible amount of detail, this one. But when it's on the tray, if you put it like this, look, it doesn't run, it doesn't drip, it withholds its shape. And yet it's a really soft flowing material, so it's absolutely fantastic for certain cases. and I would use it in situations where I'm taking an impression of a patient who might have some mobile teeth, and I don't want to put too much pressure on those teeth while I'm removing the silicone. Or sometimes if the patient has got those interdental spaces and the silicone material can flow in around the teeth and then lock in, so then when you're trying to take it out, it's really difficult to get it out with a firmer material. And because this is so soft and flexible, when you take the tray out, it just stretches and it tears in those areas as well. So it just means you're going to get a really nice accurate impression, but without the fear of it stretching and distorting, or more importantly, without it locking in to those teeth as well. So that's it. Hope you found it useful. If you've got any more questions or anything about what I've just spoke about, then just leave a message in the comments.